Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Levels of hormone during ovulation. All hormones will peak at the time of ovulation, including the luteinizing hormone and follicle stimulating hormone. Estrogen peaks just before ovulation, that is, estrogen peaks around 24 to 28 sorry 24 to 36 hours before ovulation. Progesterone peaks at day 22 of the cycle or 8 days after ovulation. At day 2 of cycle, progesterone will peak. The size of corpus luteum is maximum and all the tests of ovulation are done on day 22 of life.
at day 22 of life, progesterone will peak and the size of the corpus luteum will be maximum, and thus all the tests of ovulation are done on day 22.
At high concentrations of progesterone, negative feedback on luteinizing and follicle stimulating hormone is seen. Level of luteinizing hormone and the follicle stimulating hormone are minimum in secretory phase or day 22 of cycle or 1 week before menstruation.
Because on day 22 of menstrual cycle, progesterone peaks and progesterone inhibits LH and FSH, and thus there is minimum secretion of LH and FSH is seen in the secretory phase, that is in day 22.
Metal smirch syndrome is a mid-cycle abdominal pain or pain in the abdomen which is seen at the time of ovulation is called as metal smirch syndrome.
Thank you, and thank you for watching.